Ring, ring, ring.
Hello?
Hey, is this Dr. Michaela?
Yes, it is.
Okay, well, I am Savannah Hillman. I'm the nurse for Edith Jacobson. She is an 85-year-old female. She had a left intertrochanter hip fracture. She has surgery for tomorrow. She has history of osteoporosis and recent dizziness. You have her on enoxaparin to prevent DVT. The dose that you have her on is 30 milligrams, but the available dose that we have is 40 milligrams. Would you like to keep it at that dosage since she is only 104 pounds, or would you like to up the dose?
Just keep it.
Okay. And then I also had a question about the morphine you had her on for pain. It says as needed, and on the med sheet it says 4 to 6 hours. So what would you like for me to do with that one?
Do it at 4 if she's not in pain, and then do 6. I'm just kidding. Do it the other way around. If she's in pain, give it to her at 4, and if not, just wait till 6.
Okay. And then you also have her on hydrochlorothiazide for edema. Would you like for me to go ahead and give it to her even though she is pre-op, just as a preventative measure? Okay, so you want me to give Miss Jacobson 30 milligrams of enoxaparin.
Yes.
Okay, and then you want me to go ahead and give the 12.5 milligrams of hydrochlorothiazide.
Yeah.
Okay, and the morphine 4 hours if she's in pain, and then if not, wait till 6 hours.
Yes.
Okay. All right. Thank you so much. Do I need gloves for this?
Yes.
Oh, no gloves.
You're not touching anything.
Did you pause it?
No. Okay.
You guys can go do yours.
Yeah.
Why
Do you
would
wanna go?
Do it?
I don't know how to do it.
It's all in the instructions. It's like literally like word for word what you're doing.
Oh, if you want to do it, I'll record you.
Oh my goodness.
Okay.
Do you show getting the instructions? I need to watch someone first.
You have to show.
So I'm going to do the enoxaparin. She is getting 30 milligrams, and we have it in a 100 milligram vial, so that means she's getting 0.3 milligrams. So I will use a TB syringe, which is 100, it's 1 cc or 1 mil. I'm using a sub-Q needle because she is getting a subcutaneous injection.
There's solicitation that you're doing for the iron.
So I will verify that it is. And then I would verify it with the MAR, and then I would scan it, and then I will go ahead and prepare it. Wash off the top.
And I'll
Wait, Jack, what's your
And
song?
I'm gonna,
yeah. You can watch the.
for 0.3,
I'm gonna watch
here.
Before you can watch the.
Are you? Oh wait, so you're filming?
and then I will pull out
I'm not winging it, I have papers.
0.3.
You're just gonna have to tell me things that don't be difficult.
She's about to film the video.
Not yet, I mean.
I probably wouldn't let it just drip out, but
Okay, you ready?
Sorry, recording?
Yeah.
So we're also gonna
you want to make sure and go a little bit past 0.3 to make sure that it's getting in.
I'm trying to figure out.
Doesn't matter.
And I'll make sure all the air is out,
Just let me know when you start.
and make sure the syringe is filled up. And then I will
This is
on.
Dr. Carmel.
Yes?
Alright, this is Shannon Overstreet. I'm a nurse on the acute 1 floor, and I
Will you
have
pause
one
it?
of your patients. 2 hours before
And then we
surgery.
are
and
doing
you have
12.5
30
milligrams
and
of
I was wondering if you wanted to
hydrochlorothiazide.
Why would I want to
And since the available dose is 25
because the
milligrams,
dosage
I will
you
have to
now
cover
is a little lower
that.
than recommended 40 milligrams on the drug chart.
Do you remember what her weight is?
She is 104 pounds.
I'd rather keep the 30 milligrams.
All right, so keep the 30 milligrams subcutaneous now and every 12 hours until surgery.
Yes.
All right. Additionally, I have a question about the hydrochlorothiazide.
And then we'll do the morphine. She's doing 5 milligrams, and the available dose is 10 milligrams per 1 mil, so she will get
orally,
0.5 mils.
but there's two ways. There's a capsule.
And since
as
we
well
are
as
giving
a
it
tablet.
IM, I will need a 1-inch syringe, and it is a 21 gauge because I'm going to give it in the deltoid and can use
So I have a
anywhere
tablet,
between
12 milligram, 12.5
20 to 25
milligrams,
gauge needle.
orally once a day, 1 hour before meals.
Yes.
Okay.
All right. And lastly, I have a question about the morphine you ordered for the patient. The frequency, the recommended in the drug chart is 4 to 6 hours, and you just have PRN, and I was wondering what frequency you would like that
Is she
medication
in
at.
pain? Like,
I'll do it as a precaution. I'm not sure if we're supposed to, but I'm
Pain,
going to do it
level
just
right
in
now
case.
is at 8.
yeah, well, let's change that to 3 to 4.
All right, 3 to 4 hours
I'm going to
PRN.
draw out
All right, so I have morphine, 3 to 4 hours PRN, 5 milligrams.
Yes.
All right, well, that's all I have for you today. Do you have any questions for me?
No.
All right, bye.
Bye.
So I'll get all the air
All
out.
right, now I would prepare my medications.
Okay,
I
make sure
have
the needle
my
is full, and then put the cap
hydrochlorothiazide,
back
and it
on.
was at 24 milligrams tablet, and I already have it 25 milligrams tablet. Sorry, and I already have for the pill, so it's now
I need to change my gloves,
12.5
you think?
milligrams as needed.
No. Okay, so now I can go in and
Now
administer
I
it to the
will,
patient.
prepare my injections for the patient, starting with the morphine, which we need 5 milligrams. In the bottle reads
I got it.
10 milligrams every milliliter. So we
Okay.
will
Are you putting it on that side? Are you putting it on that side?
treat
I don't know. I don't think it matters.
Okay. You want to talk for the patient too? Okay. Good afternoon, Ms. Jacobson.
Hello.
My name is Savannah Hilbert, and I'll be the student nurse today, and we're just going to give you some meds. Perform hand hygiene and then put on some new gloves. Would you please state your full name and date of birth for me?
Edith Jacobson. 2/16/22.
Okay. I would check her ID band. She doesn't have one on, but I would check it and make sure it matched up with our records. How are you feeling today? Good. Okay. Would you mind rating your pain on a scale of 1 to 10 for me? 1 being no, or 0 being no pain at all, and 10 being the worst pain you've ever felt?
About a 6.
Okay. Well, I've got some morphine here, so we can go ahead and give you some pain meds. Okay, so you are getting enoxaparin for prevention of DVT, so I would make sure and monitor
And, good. Out. 4 to go.
Okay, so I would take her vital signs And I would also draw blood to establish a baseline for her coagulation before giving her enoxaparin, and then before giving her the hydrochlorothiazide, I would take a urine sample to measure her electrolytes, and then also I would also take her blood to, again, measure the glucose and her platelets and establish a baseline for those. And then for the morphine, I would want to make sure and do her vital signs, especially her respirations and heart rate, because the morphine can cause her respirations to get really low as well as her heart rate. I'm going to go ahead and do that before administering it.
Okay.
Thank you. Ms. Jacobson, I'm going to listen to your lungs. If you just want to breathe through your mouth, take deep breaths for me.
Medication for enoxaparin, we need 30 milligrams. This is 100 milligrams every milliliter. So we will need 3 milliliters.
Okay, and then I would count her respirations with the mannequins off, so I'm just going to assume that it is at normal and that she is at 60 breaths per minute.
She was saying that we didn't have to have her.
Okay, so the first injection is she should be laying supine, and it's going to be a deep subcutaneous.
None of us can't. Like, we're all getting it
Actually
done.
injected on the mannequins, so I'm just going to use this. Okay, so we are going to give you the enoxaparin. So I'm going to go ahead and just wipe off the area.
Oh, for this. For video. Oh, I don't know, because she was
And
saying
this
that.
is a deep subcutaneous, so I would just go a little further and make sure it is at a 15-degree angle.
Okay. So Ms. Jacobson, I'm going to tell you a little bit about the medications, things to look out for. So we're going to start with.
Okay, so she is receiving 0.3 milligrams.
I need you to watch it for
So I'm going to go ahead.
freezing. Let a healthcare person know immediately if you see
Is
those.
there anything else I need to do before?
If you have any numbness in your lower limbs.
Okay, you may feel a little sick. Just breathe normal.
Drugs. Aspirin.
Okay, so I would inject all the way in and then inject it.
Now we're all prepared to go into
Okay, and then with this medication, then I would make sure and discard this in a sharps container, but we don't have one over here. So I would make sure and not rub the area. I would just make sure and look at it and make sure there's no adverse reactions, no redness immediately, and then I will move on to the next one. Okay, so now she is going to get her hydrochlorothiazide. This is for the edema. You do not have any right now, but we're just going to stay ahead of it because you are going into surgery tomorrow. So then I would give the patient some water and have her take it, and she would take the medication. I'd make sure she swallowed it and inspect her mouth to make sure that it was also given with food. And it is important that this medication is given in the morning to prevent nocturia. We're going to go ahead and do the last medication, which is the morphine. This will help with your pain. This one is going to be given intramuscular, so I am using a 1-inch syringe, 21 gauge. I'll go ahead and clean off the site. I would usually give it in her deltoid since it is only 0.5 and it's just a very easily accessible area. Okay, so when the alcohol dries, I'll put it in at a 90-degree angle. And then inject the medication. Again, you do not want to rub the area or apply pressure or anything. Okay. So now it is important for the enoxaparin that you avoid alfalfa, and then you're supposed to notify us if there is any edema present, or if you notice any bleeding or rash or redness at the injection site. You're also supposed to notify us if you have any excessive nosebleeds or bruising. And then with that medication, after 4 hours, I would come in and redo the platelets and look at the injection site because that is at the peak of the medication. And then I would also inspect the gums, arms, and lips for bruising. And then with the hydrochlorothiazide, I would make sure and tell the patient to avoid licorice, no alcohol. You're not going to get any alcohol while you're in the hospital, just make sure and avoid it. And then we would increase her fluids to avoid dehydration. So I'd make sure that she's drinking enough water, kind of give her a goal for each hour. And then she is to report any muscle cramps and any dizziness, any more dizziness. And I would come in after 2 hours and recheck her electrolytes and make sure and continue to monitor her eyes and nose, and then make sure she doesn't have any muscle cramps because that is an adverse reaction to the medication.
I think I did that.
And then again, you are supposed to avoid alcohol with morphine. And if you have any signs of difficulty breathing, just let us know. Press the call button because morphine does have, but morphine can lower your respiration, so we don't want them to get too low because it could be a bad thing. And then you could also experience some constipation, so we may try to get you on some Miralax or something to help with that. And then there's other things that we will need to do, but we can talk about that after surgery because it's important to do after surgery. And then I would come in and reassess the patient's pain 30 minutes after administration and make sure and really monitor her respirations. Ms. Jacobson, how are you feeling since you've got your medications?
Good.
Good. Could you rate your pain for me? I know it's still early, but could you go ahead and rate your pain for me on a scale of 0 to 10?
The 5.
It's still at a 5? Okay, well I will be in about 30 minutes and that should be when the medication fully kicks in and we will monitor your pain then and go from there. Do you have any questions for me?
No.
Okay, well your call light is right here if you need anything. Back up. And again, my name is Savannah Hilbin. If you need anything, just go ahead and give me a call.